Is government broke? You know, you are reducing government to an individual like a ruling person. Okay. No, government is not broke. And it really takes time for government, especially modern governments these days. They never get broke. No, government is not broke. It's still running its services, it has the money, and so please, let's not go that way. So that was, reducing the whole government of the Republic of Uganda plus the 46 million Ugandans and the entire wealth of Uganda being nothing, getting finished. No. But let's take one point. Enhancement has started, it is on course, and it will continue. Including everybody, including the medical workers. Up to 100%, we fulfill those pay principles we agreed on in 2017. After that, again, the chain repeats itself. So I am making an appeal, a very passionate appeal. And this is an appeal of an elder, civil servant. Don't lay down your tools. Medical officers, please, go back and work and save our lives so that we can even make more money and we enjoy our country and we move when it comes to it. Now, I would like really to make a statement on the planned industrial action by the medical officers, special grade. Now, by way of background, really, you recall, in July 2003, government adopted a single spine salary structure with the U Nomenclature, U1, U2, USE, like that. And this has 8 levels, ranging from U8 to U1, with the scales having incremental levels, while others having fixed points. Now, job grades in government and corresponding pay are determined scientifically using set principles such as the Job Qualification, the effort required in carrying out that job effectively, effort both mental and physical, the experience, risks, responsibility, but also now the cost of living. And then the approved compression ratio, from the top, the highest paid, to the lowest paid, that's what is regarded as a compression ratio. And then, of course, the benchmark jobs elsewhere, even within the country. And then, of course, finally, the economic projections and the proportional wage against other critical sectors and the sector priorities. Now, how far have we gone in making sure that we really have good wages? Cabinet in 2017 under various minutes, 502 and 509, approved pay targets for all the jobs in the public service, taking into account those principles that I've just briefly enumerated. But we also, before we came to that as cabinet, we carried out some benchmark exercises of similar jobs in the service in South Africa. We went to the United Kingdom, we looked at Kenya, Tanzania, Rwanda, and a few other countries. Now, although the majority of the public officers in the service are earning as low as 18% of the approved pay targets since 2014. Most of the medical officers, however, have achieved their approved pay targets, a good number of them by 100%. And others have even gone beyond 100%. You know, by way of illustration. For instance, a senior consultant at U1SE level, the current pay he gets or she gets is 13 million 113,953 shillings today per month. But the approved target, we think, when everything goes well, in the next 2-3 years or so, the senior consultant should be able to earn 17,760,959 shillings. So at this level, at least the senior consultant has gone to 74% of the approved pay target. Now, a consultant at U1SE, this is special, gets 12,321,555, and the approved target is 13.9. Now, this one getting 12 million has reached 89% the pay target. A district health officer at U1E gets 6,500,000. The approved target is 10.1 million. Now, this officer is at 64%. Now, the medical officer, special grade, or the principal medical officer at U2 gets 6.0 million shillings. The approved target is 6,185,254. So at the moment now, this officer has reached 97% of the approved pay target. Now the senior medical officer, who is at U3, now gets 5,884,476 shillings. The approved target is 5,714. So this one now gets 102%. And then the medical officer at U2 gets 5,408,476,000, and the approved target is 5.074662 million, and this one now is at 106%. Now the pay for medical officers, dental surgeons, especially at the level of medical officer special grade, stroke, principal medical officer, senior medical officer, and medical officer based on the job weights above, historically provide very small differentials. Now there is very little difference between this category of officers, you know, both in terms of expertise and the job weight and so on. Now the significant enhancement for consultants and senior consultants was based on the highly specialized nature of their jobs. Consultants is specialized. And the weight, or the weights of these jobs. And then of course the benchmark of similar jobs with other countries. And let's not forget, as a strategy for attracting and retaining these highly trained and highly specialized people. You recall, many of these people are running away to the neighbors and to other countries, the UK, elsewhere. You see, recall, you just go to Nairobi here. The most experienced doctors that are going to attend to you are going to be Ugandans. So say no, as a strategy, let's pay them very well, that they come back and serve us. And it has worked. Many of them have come back and they served us. In addition, apart from retaining them, in addition, there was the consideration that the specialized hospitals which you have created, the national referral hospitals which were also created, as well as the regional referral hospitals which you have created, must have specialists. And the only way you can make sure that these specialists are there is by paying them well, so that they are there. And this fortunately has happened. So the strategy is correct. It has attracted these special people, and they are there. Now, when given that background, we now look at the planned action, industrial action by medical officers who are in special grade. Sometimes we don't understand. We don't. Yes, it's true. Actually, public officers enjoy freedom of assembly and association in accordance with the Section GA, Paragraph 3 of the Uganda Public Service Standing Orders 2021. The enjoyment of these rights and freedoms takes into account the laid down procedures and through the established public service labor unions, and this is in tandem with Section 8.1 of the Public Service Negotiating, Consultative and Dispute Settlement Machinery Act of 2008. These procedures, by way of refreshment, among others, include notice of the strike. You must give notice. And this notice must be accompanied by a certificate signed by the chairperson of the Public Service Negotiating and Consultative Council. And that certificate must state in no unclear terms that 90 days have elapsed since the date of the report of the labor dispute to the council, since the notice was given. 2, that actually the dispute settlement machinery has been exhausted. That all other measures have been undertaken and so on, but now these measures have not yielded the desired result. Therefore, the next course of action is to carry out an industrial action, to go on strike. But in addition, the 6th schedule of the Public Service Negotiating, Consultative and Dispute Settlement Machinery Act of 2008 gazettes a number of services which are categorized as essential services. And these services include health. It's an essential service. They include sanitary facilities. Yes, even a simple service like collecting garbage, that's an important service. Hospitals, and all of them are categorized as essential services. In other words, much as you can carry out industrial action, these services cannot completely close because they touch life. They touch life. You cannot close. Yes, you can carry out industrial action, but you cannot completely close. Therefore, the notice of industrial action by the medical officers, this as we talk now, has not been formally received by the Ministry of Public Service. We don't have that notice. No. We have just heard about it in social media, here and there, and so on. And people have been to the hospitals telling us, oh, we don't see these people. So the formal approach has therefore not been followed. And we can say technically that for us, we don't know about it. So, how do we move? Really, first of all, it's unfortunate that this action is being implemented, and that in one way or the other, maybe some people have on their own started implementing the sanction. So what we are saying really as a way of advice is that yes, can't we rethink about the sanction, you know, as political officers, those who are in the special grade, and say, okay, why don't we formally register the complaints using the laid down procedures in the law? And since we are all law abiding, let's register them. Let's give the notice. But also when you look around, really, we may ask, is it necessary? Or at this time, really? Is it really, should this action be taken at this time? And should it be taken in that form? When actually, according to the pay plan, these officers have got an enhancement which on the average is above 90%. Therefore, really, can't we think twice and say, look, why don't we call off this planned industrial action? Because in a way, it may make us look funny, you know, as health workers, and people have so really protect life. The medical officers' pay, as far as is concerned in our situation, is actually fair. It is fair. If you compare it to the pay of the general workforce, as I told you, a large section of the workers have got only up to 18%. But here you are. You have got up to 90%. And you're complaining. Really, you're complaining. And what about the other one who has got only up to 18%? What will that person do? Get a panga, an axe? They look funny. And by the way, shame. Shame is a revolutionary sentiment. Since we are all revolutionaries in this matter, let's be seized with shame and say, wait a minute, why don't we call off this planned industrial action? Because we are being revolutionaries by actually feeling that it's not fair given other workers. But if we compare, for instance, the pay of these medical officers special grade with what others are getting in the private sector, in the same sector, our pay is reasonably well. It's reasonably good. Yes, it's reasonably good. Compare what somebody, a medical officer, gets in a private hospital and what we are paying. It's reasonably good. But also even within the region, our pay is equally good. It compares very well with what other people are getting. That's why, as I said in the beginning, that many of these senior people who are gone out have now opted to come back and they are here with us. You see? And of course, in view of the performance of the economy, really, our economy and what I think our pay is really good. Let's also not forget that at this time, honestly, at this time, when we are recovering from the shocks of COVID-19 and other geopolitical events that have impacted, sometimes negatively, against our economy, is this the time for us now to become agitated and so on and so forth? Even when we have said we are committed as a government to having good pay, and we have practically demonstrated that commitment by actually enhancing up to 90%, 102, 106%. Can our credibility now be doubted as government? So We are committed to implementing the pay plan. And we are on course. If it had not been for these other interventions, we would have already done away with this, and I think now would be considering the next stage of enhancement. But we are committed and we are going. And by the way, before we reached this, we actually had engagement with these medical officers. They themselves, their leaders, the ministry officials, and everybody. Because this is a really serious matter. And we agreed that given the circumstances, this is what we can do so far. That was last year. Last year, we had a series of meetings. And the meetings were not only in Ministry of Public Service or Ministry of Health, but they went up to the highest office in the land and reached agreement. As Ugandans, honest Ugandans, it was not just even a gentleman's agreement or gentle lady's agreement. It was a real agreement of interested parties who are working for the good of this country, for the good of ourselves all together as Ugandans. We said, okay, so far so good, we are going to work. Hardly before even the years ended, and now we are turning around. We are turning around. So it is not really a problem. We said we would deliver our service to the population, and okay, up to now, since then up to now, the services have been delivered. And now things are turning around. I don't understand. What's the problem? What's the problem? Yes, we are committed and we are moving. So really, I would like to make one passionate appeal to my fellow countrymen and fellow countrywomen, to my fellow servants, servants of the people, that please, senior medical officers, do not go on strike. Do not put down your tools. Instead, work. Work, and then all the other things will be sorted out. We are committed. And there's no turning back. There's no turning back. We have gone through the debate of the economy. Yes, that debate has been in Parliament and so we have really gone through it all. We know exactly how our economy is now. We have looked at the various priorities and we have decided really as a country that if we put money here and there and prioritize, we are going to raise more money. And with more money coming in, then the issue of enhancement will take center stage. Why should we now move now? It's when the things are moving and we need to really be serious over this matter and we need to save life and so on. Why should we now turn around and say, oh, look, we are now laying down our tools and we see people dying and suffering and so on. So I am making an appeal, a very passionate appeal. And this is an appeal of an elder, civil servant. Don't lay down your tools. Medical officers, please, go back and work and save our lives so that we can even make more money and we enjoy our country and we move when it comes to it. Thank you very much for God and my country.